Welcome to Eurofins Viracor Clinical Diagnostics Podcast, where I'll be sharing up-to-date scientific advances, key diagnostic testing, and our most recent innovations. Enjoy part 3 of our 10-part series, originally broadcast live from ATC24 in Philadelphia.
Good day. This is Kevin from Eurofins Transplant Radio, Viracor Reviews. It's day 4 of the American Transplant Congress 2024, located in sunny Philadelphia, Pennsylvania. Sitting in booth 300. We have 2 special guests today joining us to talk about transplant. Dr. Sejal Patel. I know I was going to butcher that. I apologize. And Stephanie Clifford. I could butcher your name too, Stephanie, make everybody feel better. But we're going to talk a little bit about transplantation. We're going to talk about the Trulo study, which is ongoing and getting into its second year here, collecting great
and beyond
great data on post-transplant patients and the impact of the transplant genomics TrueGraph assay, and along with the Eurofins Diagnostics track assay, their applicability as individual assays and as a dual marker, what the NPV is, or negative predictive value, and PPV, positive predictive value, and other great learnings that we've had in these last few months with the Trulo study going on and such. First, I wanted to start off and say congratulations. I saw poster number 133 out on the showroom floor. Got a Best in Show ribbon for your talk about time-dependent impact of positive peripheral blood gene expression profile results on renal function interim report from the Trulo study. So why don't you take some time, introduce yourself to our listeners, talk a little bit about what you do with the Transplant Genomics and CGI group within Eurofins, and then we'll dive a little bit into your poster presentation if that works for you.
Yeah, sounds great. Sounds great, Kevin. I'll go first. So my name is Stephanie Clifford. I am a medical science liaison for Transplant Genomics. I've been with the company for a couple years now, and really found it really highlights my passion for contributing to the transplant community. As you said, Transplant Genomics has assays to help with ruling out rejection in kidney transplant patients. And we have more to come with liver assays that will be coming out in the near future as well, which is very exciting. So I'm the Eastern U.S. MSL. So basically, I go out and meet with, our physicians and clinicians that are in the field on the front lines taking care of these patients, and trying to understand what is challenging for them and what, how our assays can fit into their day-to-day care of these patients, and see what they need from us. As a company, collaborating with them and trying to push the envelope of innovation and seeing how we can make our products better, and how they can currently use what products we have to help these transplant patients. At the end of the day, the goal is, transplant is such a precious gift. The clinicians that take care of these patients are very special. The patients are very special. And, we want to help support that in any way possible. So just getting out there and, making sure everyone understands how the tests are used, new information that comes out about the tests, and how the best way to rule out rejection is and keep these kidneys as long as possible.
Very good. Dr. Patel?
I'm Sejal Patel. I'm the MSL for the West Coast. I just joined the company in October, so relatively new to the molecular biomarker arena. I have heard of them. I myself am a kidney pancreas transplant patient, so I come to the company with a great passion for patients like myself and just helping the transplant community in general. It's amazing to be in the world of transplant and, immersing myself around different transplant surgeons and transplant physicians, and being able to help, spread the word about molecular biomarkers and what they can do for patients and the physicians, and helping them manage their patients. So we're just, in this whole new arena of discovery and helping, so many different avenues of just discovery in the transplant world. And, it's very amazing to be a patient in this field as well as be a part of that change. So, as Stephanie said, that we are coming up with new biomarkers for liver and, kind of moving into the infectious disease arena as well, and just kind of, using these tools to help guide our patients and physicians to help better manage their patients in terms of different arenas and how we can actually help produce, or keep patients with their kidneys as long as possible. And that's the ultimate goal at the end of the day. So very excited to be here at the conference to learn about all the new technologies and new research that everyone's doing, and just to be a part of the transplant world in general.
Very good. Appreciate that from both of you. So let's talk a little bit first about the TrueGraph assay, what it is, what it does, how it's different than standard avenues of looking for tissue rejection or organ rejection in the human body.
So the gold standard for identifying rejection is doing a kidney biopsy. And kidney biopsies are invasive, and sometimes things can go awry. Sometimes we can't get enough tissue, and the biopsy is not readable. Unfortunately, some patients experience complications and further injury to their allograft with the biopsy. And so the transplant community has really made it a major focus 10 plus years now of trying to find ways to evaluate patients without sticking a needle in their transplanted organ. And so, looking at different ways to retrieve information from the body, such as urine and blood. And so TrueGraph is actually a peripheral blood assay that looks at the patient's certain set of genes and how they express. And so we're actually looking at the RNA expression in patients to see if they match into a cohort of a immune quiescent category, or if they fall more into alignment with a patient that is experiencing some clinical rejection. And so patients, it's a great test to rule out subclinical rejection. It has a high NPV in the 80s. And so it's really giving peace of mind to clinicians. When you have when you're immune quiescent, they can be pretty confident that the patient's not in rejection, which is very important because then it can optimize their medical decision making. In the transplant world, unfortunately, to protect these grafts, we have to target the patient's immune system. And with that comes a lot of adverse effects from those medications. And so by knowing a patient's immune quiescent, the clinician can use that information to decide what to do with the immunosuppressant medications and try to get that patient on the most best cocktail of meds for that individual patient.
Great. Anything else you want to add?
No, I think so.
The important part of that really is the takeaway that this is a non-invasive assay, a simple peripheral blood specimen. You go and see your doctor, they're going to take a tube of blood anyway. Why not get an extra tube of blood to have your biomarkers monitored and checked as you're going through your therapy, as you're going through your follow-up and like this. You don't have to go into a sterile surgical suite to get a biopsy, wait on time for the preparation of the tissue.
Exactly.
And like this, and it significantly reduces the risk to the recipient in the way of subsequent infections or anything else that may pop up from the process of doing a biopsy. It's a really great assay, and I've been following it for quite a few years. I've been with ViraCore for a few years now, and it's really exciting what it does. How about talking a little bit about the TRAC assay, how that fits in, kind of hand in glove with the TrueGraph assay?
Yeah, I'll bump that one to Sejal.
So the TRAC assay is just the donor-derived cell-free DNA test that we have, and of course it's a highly dynamic test. Its half-life is about less than 1 hour, and it reports the donor-derived cell-free DNA over the total cell-free DNA. So it kind of gives us an idea of what's actually happening in the kidney and if there's any kidney injury actually occurring. And so
And so paired with TrueGraph, TrueGraph is looking at the recipient's immune system. We just talked about that. We're ensuring the patient's immune quiescent. And so when you pair TrueGraph with TRACK that Dr. Patel just mentioned, TRACK is looking at the injury of the allograft. And so one's looking at the actual allograft injury and one's actually looking at the immune system prior to injury even potentially occurring. And Dr. Park had a paper published in CJASN back in 2021 with a whole group of excellent investigators looking at the performance of combining TrueGraph and TRACK together. And they found that, both tests individually are good rule-out tests, have an excellent negative predictive value in ruling out rejection in kidney injury. But when we combine them together simultaneously, it increased the positive predictive value significantly, up to 89%. And that was really a game changer. And there's more coming out. There's more investigation into combining those two tests together. In the meantime, clinicians can take TrueGraph and use it as surveillance in their stable renal function patients, because that's the purpose of why it was developed, and ensure that they're immune quiescent. If not, it's giving them an idea that, hey, something's going on. Let's take a closer look at the patient. And that's where TRACK comes into play and works really well in identifying if there's injury going on.
Yeah.
Right.
And then certainly, continuing to go from there, either to biopsy or if they want to do other diagnostics to see what's going on.
Yeah. So basically, it helps the clinician make that determination. Do I really need to perform a biopsy on this patient? As we said earlier when we started out, we threw out the word NPV and PPV. NPV, negative predictive value, and with the TrueGraph assay, it has a mid-80s NPV, which negative predictive value, which says there's no signs or symptomology that would indicate damage going on, which is good. And a lot of us in the medical field, or even as patients, you look for these low value, high values on your lab report, and it's like, wait a minute, I don't have a high value, I've got a good value. And what does that mean? Well, you just have to change a little change of thought there. That this is a marker that says you should be negative for developing rejection by utilizing this assay. Then, as you're saying, Stephanie, with the PPV being increased by combining the two, that's when you kind of get into the low and the high values. Your positive predictive value means, okay, great, I'm a little bit high here. We need to, as a clinician, do something about that. And the other thing too is, if patients are reviewing their lab reports, they're going to get a little, extra characters on the report that say TX or not TX or non-TX. Can you explain those to the listeners?
Certainly.
They might have seen it on one of their lab reports.
Yeah. So not TX means not transplant excellent, which means the patient's immune system is not quiet. It's not quiescent. Not quiescent. And so that's where we consider that the test is a good rule-out test, but not, certainly telling you, yes, you're in rejection with a not TX. It's just telling the clinician, hey, your immune system is not quiescent right now. Let me take a closer look at what's going on. If everything looks great, they may monitor the patient in a month or 2 more months, or they may decide to get more information at that time, like a TRACK assay, donor-derived cell-free DNA. And then TX is
transplant excellence, so it means the kidney's doing okay, or the immune system's doing okay. I'm sorry about that. And there's no immune activation currently occurring, and you can just carry on monitoring the patient as you normally do.
And that's really where the power of TrueGraph lies. You want to see that TX, that transplant excellence, because that's really the power of the test, letting the clinician know they're immune quiescent to continue to make clinical decision making best for that patient, and really honing in on precision medicine.
And just the power of the rule-out test, and making sure that how important that is, and not knowing that your patient is having some sort of immune activation, or with the for-cause test, if there's no actual kidney injury occurring. So the power of the rule-out test is very important.
Very good, very good. Great background information, and that then leads me to segue into the poster that was presented today. Would like to learn more about it, hear more about it, what you were looking for, and and ultimately what you found out.
Yeah, so this was an interim analysis from our Trilo study. They looked at 826 patients with 12 months of follow-up, and what they wanted to see if there was any impact in renal function. And interestingly, they did find that on patients that were in the Trilo study, if their initial TrueGraph result was not TX, it was prognostic that their eGFR over the follow-up period of 12 months would decline significantly regardless of any future events. And that was really telling because, it's giving a warning signal like, hey, this immune system's activated. And, from the way that it does perform, it's not a high positive predictive value test, right? The power is in ruling out rejection. But it's telling us something that maybe biopsies potentially are not picking up right away. So it's telling us the immune system's activated, something's going on. And from this interim analysis that the eGFR declined significantly more in those patients and patients that had an initial TX result.
Okay. So for our listeners that did not get a copy of the secret decoder ring for all the acronyms we're using here.
So sorry.
eGFR, estimated glomerular filtration rate, is basically an indicator of kidney function, how well it's doing what it's supposed to be doing.
Correct.
What else would you like to add to that?
That's essentially it. It's a gold standard marker of evaluating renal function in patients with a transplant or not. And it's very important because the eGFR, obviously we want the kidney to perform well, but the kidney's under a lot of stress from immunosuppressant medications. And so it is very sensitive. And the more it declines, the more trouble you're going to be in over time. And eGFR is measured by a combination of different diagnostics, but essentially we know that once you start seeing renal injury that's measurable on diagnostics, such as creatinine, a significant portion, about 30 to 40% of the nephrons of your kidney have already been damaged. And so it's really a late lagging indicator of injury.
And just like the TrueGraph or TRAC assay, it's an assay or a determination that's made off of a blood draw. It's a simple blood draw.
And then another important finding in that poster was
it showed that the initial not TX results were prognostic of a decline in that GFR, and it was over follow-up regardless of whether future events in those patients occurred beyond that year of transplant. And for every not TX result that occurred, it was associated with nearly about a 5 ml per minute per 1.73 meters squared decline in that GFR. And that was when we were controlling for that impact of rejection.
So, as the study goes on and we evaluate that further, could we identify, how many positive TrueGraph test results are associated with that eGFR decline, perhaps, so it's giving us a signal that the immune system's activated. There is an association that their GFR does decline in that population, and as we're able to look more at the data in the future, maybe we can give more concrete data as to the risk of your eGFR declining with each individual TrueGraph not TX, or even over a certain period of time.
Right. So, gonna take a little information off ramp here. You've dumped a
Lots of science.
A lot of science, a lot of acronyms. To buy your secret decoder ring, no. we do talk a lot of acronyms in the medical field here and such, but just a couple of quick questions, I guess. What is it about what you do makes you jump out of bed in the morning?
I will start. So my background is actually, I did pediatric heart and lung transplant before joining Transplant Genomics, and I've taken care of kidney and liver transplant patients and peds as well. And that is such a special population, and I really fell in love with transplant as a clinician. And now I get to have a broader impact in bringing innovation to the transplant community. Anyone that's listening that it works in pediatrics, we kind of get the innovation last, because everything, all the randomized control trials are happening usually in the adult populations, right? And so it's always like I was sitting on the sidelines watching innovation unfold and wanting to be a part of it. Certainly we bring things to kids, but that's what motivates me. I want to accelerate the science and getting that out into the field, so we can get it to those pediatric patients even faster, and get it to these transplant patients even faster. And so that's what motivates me, just having a broader impact to the transplant community as a whole.
Very good. And you said, Dr. Patel, that you're a newer addition
Yes.
to the Transplant Genomics, so Eurofins transplant team.
For me, it's just I live, breathe, and it's my day-to-day. So just being a transplant patient and just working in the field, it's always what I've wanted to do and dreamt of being. I grew up just always wanting to be a doctor and helping science in some way or another. And I kind of took a road trip in terms of what I wanted to do in terms of patient care, and started working in research. And I just saw how it helps a world population of people versus just one. And I feel like moving to industry, I'm in it. I'm in the innovation. Things move fast. You have to keep up with the competition. And I think that competition drives patient care. And I think it's not even about just being in industry, but it's what we're doing for our patients. And I think that's what gets me up every morning, and seeing all the exciting stuff that we're doing for our patients and how we can improve daily. I wake up every morning and I see new things about what people are doing, what's happening in the transplant world. And so I think just having that motivation and being out in the field and working with physicians and how we can help them to improve their patients and their care. And I think that's it's just full circle in the sense of for me, just being able to be a patient and then also just working in the field that helps drive that innovation.
Right. And I guess kind of an underlying message that I've gotten from both of you on this is, the Eurofins family, Eurofins Transplant Group, we've got 5 different business units all underneath one umbrella, going anywhere from pre-transplant through post-transplant follow-up and such. And really, the uniqueness of Eurofins and our account executives, MSLs, all the different titles that we have, is we really look at providing or educating the physicians, the end users, on what solutions we have to help them solve their problems. We're not there just to say, hey, I got a bag full of tests, let me tell you about each and every one of them. It's let's find out what your problems you're encountering, what you need to help your patients live a better, healthier life. Oh, we've got this product and this is how we can help you.
Exactly. Agreed. Just an extra tool in the toolbox.
All right. Appreciate your time this morning, ladies. Take care, and we'll be back in about another hour for our next session of Eurofins Transplant ViraCore Views. Thank you for listening.
Wonderful. Thanks. Thank you.
Make sure to subscribe to this podcast and follow us on social media to stay up to date on all the latest information. If you want to help spread the word, please give us a 5-star review and tell your friends and colleagues to subscribe too. With over 40 years of diagnostic innovation and specialized expertise in infectious disease, pre- and post-transplant, allergy and immunology testing for immunocompromised and critical patients, Eurofins ViraCore is committed to helping medical professionals, transplant teams, and reference labs get results faster when it matters most. ViraCore is passionate about delivering value to our clients by providing timely, actionable information, never losing sight of the connection between the testing we perform and the patients you serve.